Welcome back to the Morning Blend. It's hard to lose that stubborn fat around our arms. So today, different treatment options to target that loose skin and excess fat.
Dr. Daniel Butz is a board-certified plastic surgeon with Quintessa Aesthetic Center, and he's here to tell us more. Good to see you.
Yeah, thanks.
Yeah, good morning.
Yeah, so when people come in and they talk specifically about their arms, I think most of us don't like the look of our arms, you know, unless you got really, really thin, long arms, which is not the majority of us. What are the common complaints that you hear from
A lot
women?
of it's just, not feeling comfortable wearing short sleeves, especially, that summer's kind of in the horizon. People are coming in worried, oh, can I do something about this so I can feel more comfortable, in the summer months? Just anything, even, being social, they feel like everyone's always looking right at their arms. They feel very self-conscious about that.
Well, it's interesting because I think a lot of times it can be a lack of tone, it can be excess weight, or it can be even having lost weight. Like I know I have somebody in my family who lost a lot of weight, and so it's like she feels really thin, but now the look of her arms doesn't match because that excess skin doesn't necessarily go away.
Absolutely. I mean, and a lot of it can also just be genetics. You can be really thin, but oh, my mother had this, my grandmother had this. Like, they hated it. I want to do something about it. But yeah, weight loss patients. I mean, that is a very big population that has a lot of problems with extra skin, kind of everywhere.
And I just feel like so many dresses are sleeveless.
There are way too many sleeveless dresses.
Way too many sleeveless dresses. So that's
Who's
why
designing these?
Yeah, that's why you're here to help. So let's talk about treatment options, because there are some surgical options, and you do a lot of that, but there are also non-surgical options.
Yeah, so depending on kind of what your concern is and what how severe it is, there are options that range from just a halo laser, which we typically use on the face, but it's a great way to kind of tighten and tone the skin. Can really improve some of the textural issues.
Okay.
That's a halo laser right there, and that it can almost look smaller just without using a laser by tightening that skin envelope.
And how many treatments are most of these
really
people
good
having?
The halo, those were just one treatment, but it's you can do more and get an improved outcome.
Okay.
CoolSculpting is more a non-surgical fat reduction method. In that example, it was a really nice result from one treatment. Sometimes it can take two to really get the full effect. And the skin retraction is variable. Everyone kind of varies on that. But, two non-surgical ways to you can make an improvement. And then if you're not a good candidate for one of those things, surgery where you actually excise and remove that extra skin and fat can it's probably the most powerful, but with a little bit more downtime.
Who is a good candidate for an arm lift? Is that what you call it?
An arm lift or a brachioplasty is a technical term for it.
Okay, that's what I was going to say.
Yeah, exactly.
Oh my gosh, that's dramatic.
Yeah, so exactly.
Wow.
That patient lost a fair amount of weight, had a lot of loose skin, and that's going to give a much bigger improvement than trying to laser it or cool.
And look how great that arm looks underneath the excess skin.
Yeah,
That's
exactly.
amazing.
There's a lot of tone under there. You just can't really see it from that laxity. So that's that's where surgery really comes in to excise that extra skin.
It's a lot of hard work that's not showing from the person.
Right. Yeah.
They did a lot of work to get their arm looking like that.
Yeah.
And what is the so I wonder what the scar, the healing is like in the downtime when you have an arm lift.
Yeah, so I mean the acute recovery is probably 3 to 5 days. You're having some pain, taking some pain medication, but then you're off to just or over-the-counter medications, wearing some compression wraps for a couple more weeks. No real heavy lifting or kind of big arm movements for 4 to 6 weeks. But you're back to work probably within that 3 to 5 day range, depending on what kind of activities you do. And the scar takes time to fade. I mean, it's the trade-off of the for that improved contour is the scar. Typically, it fades quite nicely over the course of 6 to 9 months. There's things you can do to kind of help speed that up.
Where is the scar? Because you're kind of
normally our goal is to kind of have it hidden, so when your arms are forward, you can't see it. Sometimes it peeks out the back a little bit, but our goal is that it's kind of in that inseam.
Yeah.
Kind of hidden there.
Exactly.
Yeah.
Yeah, you can tell everyone you're a robot.
Right.
Like this is like.
Normally, I mean, once the scar softens and fades, most people, again, the trade-off is they're much less self-conscious about the scar than they were about that skin.
And then they're wearing those sleeveless dresses.
Yeah,
right.
Showing off all that hard work they did.
Yeah,
that's true.
Yeah.
What about the halo or the CoolSculpting? What kind of downtime is there with those?
Really minimal. I mean, the halo, you've got basically these little superficial kind of what looks like burn kind of marks. It's a very controlled kind of heat that is what the halo laser is doing. So that's just kind of dry flake, kind of just slowly falls off for the course of about a week, and you're not really limited or no restrictions.
Does that hurt?
It's a little kind of, it feels like a bad sunburn.
Okay.
It's really pretty minor. And the CoolSculpting, it kind of can feel a little numb, and its initial treatment feels a little cool and kind of cold. But again, really no limitations, just kind of feels a little funny.
What if people come to you and they know that that's a problem area for them, and they know they want it to change, but they're really not sure if they should do halo or CoolSculpting or if they might instead be a better candidate for surgery.
And that's what's great about Quintessa. We have, you know, a whole host of providers, and if you're not a good candidate for the CoolSculpting or the Halo, then, you know, they send you over to me. If I see you and I think, oh, I think Halo or CoolSculpting is a good option, you know, we kind of can all work together. We all know all the different product lines, so you're not going to get kind of pigeonholed into, you know, the one thing that I do or the one thing that someone else does. So
You
that's why
help people decide.
Yeah,
You
absolutely.
do a consultation.
Yeah, absolutely. Yeah, you can do it. You know, normally it's an hour-long consultation, kind of review all the options, look at photographs, you know, talk about, you know, all the different recovery things, pathways, and help them choose what's going to, you know, help them achieve their goal.
That's
And-
great.
Yeah, and right now you have a complimentary consultation, which is great. If people mention the Morning Blend when you call Quintessa,
If you don't mention us, you got to pay.
then you're not going to get the free consult. It's a toll-free number. It's 1-800-499-4309. You can also visit them online to learn more about Halo and CoolSculpting and an arm lift, which is the surgical option. You can go to myquintessa.com to learn more. But again, make sure you mention the Morning Blend when you ask about a consultation and decide what you can do for your arms before summer hits.
Yeah, right. Do it
Perfect
now.
timing.
Yep.
Yeah, great to see you.
Yeah,
Good to see
thank
you,
you.
Doctor.
Thank you so much.